Right, this time we're on page 27, and this whole page is related to this situation here. The drug company is trialling a new drug given to patients after suffering an asthma attack. So we want to compare the rates of asthma attacks for people given the drug, and we're comparing them with a placebo. Now a placebo is like a sugar pill. So people in this experiment don't usually know which pill they've been given, whether it's the real drug or just a fake sugar pill. And obviously the drug company will be hoping that the drugs are reducing the risk of asthma attacks, I would say. Anyway, from within the trial, what is the absolute risk, which is just the same as probability, of a patient having an asthma attack? Probability of an asthma attack, 306 out of 435.7. Absolute risk is a rate per 10,000, so if we just take that probability, times it by 10,000, then we would expect approximately 7,000 people per 10,000. Although that could be rounded, so you check the rounding on that, whether it's exactly 0.7. Now we're just talking to those people in the placebo group. What is their risk of having an asthma attack? 180 out of 225.8. I'm going to lose the table in the drug group. So it's 210 in the drug group, and chance of an asthma attack, 0.6. So those are the two numbers we're dealing with. Part D wants the relative risk. So once we're talking about relative risk, we need one probability divided by another of a drug patient having an asthma attack, which is the 0.6, using the placebo patients as the baseline risk. So the placebo group was part B, which is the 0.8. 0.6 divided by 0.8, 0.75. So 0.75 times less likely to have an asthma attack if you're taking the drug rather than a standard base group. Right, moving on to part F. Calculate the relative risk, so we're dividing, of a placebo patient having an asthma attack, which was the 0.8. This time we're using the drug patients as the baseline, and we get 1.3. So 1.3 times more likely to have an asthma attack if you're not taking the drug. This is a 30% increase in the risk of having an asthma attack if you're on the sugar pill rather than the drug. Which is better to use as a baseline? We should be using the placebo group. They're like your control group, so they should be the baseline one. And we're comparing the others, the drug group with the baseline placebo group. Because like the control group, if nothing, they're just taking a sugar pill, in other words, the same as no pill at all, or no drugs at all to help them when a patient takes the drug. So not taking the drug, your risk, it's the placebo group, is 0.8. And if you take the drug, your risk drops to 0.6, and we want to know what percentage increase or decrease. Clearly it's a percentage decrease. Percentage decrease is usually the difference over the original times 100. If you remember percentage increase and decrease, the difference is 0.2. The original is 0.8 times 100. It's going to be 25%. So there is a 25% decrease in the risk of an asthma attack. If you take the drug. And that might be a great risk that you're willing to take.